Welcome to the First Fill. I'm Katie Meyer, VP of Education at APHI. In this episode, we will be providing updates about two new medications that recently received FDA approval and will be hitting the market soon. Before we get started, though, I'm delighted to introduce you to two new APHA team members, our Education Fellows for 2025-26, Caitlin and Io. Caitlin and Io, please introduce yourselves.
Hi, I'm Caitlin. I graduated from Temple University School of Pharmacy this past May, and I am one of the new education fellows for APHA.
Hi, my name is Ayo. I graduated from Cedarville University School of Pharmacy in May 2023. I just completed a PGY1 residency at University Hospitals, and I am one of the new APHA Education Fellows.
Thank you, Caitlin and Aya, so much for being here. It's a pleasure to have you on the team this year and to be part of our podcast for the next year. Now, let's dive into your very first episode. Today, we will be discussing two new drugs that were recently FDA approved. The first, gepotidacin, is a new antimicrobial for treatment of urinary tract infections. And the second, lenacapavir, a new antiretroviral for pre-exposure prophylaxis of HIV. We'll discuss clinical outcomes and trials, potential adverse reactions to be aware of, and important pearls and counseling points for each of these agents for pharmacists to be aware of. So with that, let's start with gepotidacin. Io, can you review efficacy outcomes from clinical trials for gepotidacin and how the medication is different from traditional antibiotics that we're using for UTI?
Of course, gepotidacin is the first new antimicrobial in a new class of antibiotics. Its mechanism of action includes selectively inhibiting DNA gyrase topoisomerase 4. As we know, this mechanism of action is similar to fluoroquinolones, but since it binds differently, it works in some resistant strains. Eagle 2 and Eagle 3 were two large clinical phase 3 trials that compared the efficacy and safety of gepotidacin in the current first-line oral antibiotic for uncomplicated UTIs, nitrofurantoin. Patient criteria for the trial included non-pregnant females, patients ages 12 years or older, who had two or more symptoms of dysuria, frequency, urgency, or lower abdominal pain. Patients were randomly assigned to receive gepotidacin 1,500 milligrams twice daily for 5 days or nitrofurantoin 100 milligrams twice daily for 5 days. Results from Eagle 2 clinical trials showed that gepotidacin had a 50.6% success rate versus nitrofurantoin that had a 47% success rate. Results from Eagle 3 clinical trials showed that gepotidacin had a 58.5 success rate versus nitrofurantoin that had a 43.6 success rate. Success rate was measured based on resolution of UTI symptoms and no new symptoms together, in combination with a reduction in uropathogens without the use of other systemic antibiotics. In both the Eagle 2 and Eagle 3 trials, gepotidacin showed non-inferiority to nitrofurantoin, but in Eagle 3, it had a 14.6% higher success rate, which makes it more than just an alternative option. It could be a better option in clinical scenarios, especially in patients with resistant pathogens. The bottom line is gepotidacin is a much needed addition in our oral UTI options, especially as an antibiotic resistance is always prevalent.
Thank you, Io. Now, with any new drug, there are always potential concerns, right? So, what adverse reactions were seen in clinical trials, and what clinical pearls and counseling points should pharmacists be ready to relay to their patients as it hits their shelves?
In both Eagle 2 and Eagle 3 randomized trials, gepotidacin most common adverse effect was diarrhea, affecting a total of 32% of patients in both trials compared to 8% of patients taking nitrofurantoin, while nausea was the most common side effect with nitrofurantoin. There were no life-threatening or fatal events reported. The adverse effects were mild to moderate and manageable without any medication use. Important counseling points for your patients are to take the medication with food, which would help reduce the GI symptoms, hydrate, especially if mild diarrhea occurs, and emphasize the importance of completing the full 5-day course, especially if urinary symptoms improve. Lastly, patients should be educated to watch out for any signs of recurrence or of symptoms such as urinary frequency, urgency, suprapubic or lower abdominal pain, and dysuria. Important pearls to note are that gepotidacin has an indication for uncomplicated UTIs, not pyelonephritis or complicated UTIs. Be sure to conduct past medical history on patients to find any history of past resistance or recurrent infections. Conducting past medical history on patients will encourage the use of gepotidacin as it has shown therapeutic efficacy against E. coli, which is the major uropathogen in uncomplicated UTI cases. To sum up, gepotidacin is a first class antibiotic treatment for uncomplicated urinary tract infections with a safety and tolerability profile similar to other agents. It's taken twice daily for 5 days, with mild to moderate diarrhea being the most common side effect. It is effective against common uropathogens, including common drug resistant strains such as E. coli, offering the med as a new valuable option when standard treatments such as nitrofurantoin may fail.
Thank you, Io, for a great review. I'm interested to see how use of gepotidacin takes off and impacts treatment of UTI. All right, let's move on to our next drug, lenacapavir. Caitlin, what is the most important information for pharmacists to be aware of regarding lenacapavir and its outcomes from clinical trials?
Sure. When it comes to lenacapavir, the most important things that pharmacists should be aware of are its unique mechanism of action, dosing schedule, and clinical trial outcomes, as well as drug-drug interactions. Lenacapavir is a first-in-class, long-acting capsid inhibitor indicated for both the treatment of HIV-1 infection and for pre-exposure prophylaxis. It represents a novel class of antiretroviral therapy with a unique mechanism of action. Lenacapavir binds to the HIV-1 capsid protein, interfering with multiple essential stages of the viral life cycle, such as capsid disassembly, nuclear import of viral DNA, and capsid assembly. Unlike traditional HIV classes, lenacapavir targets a completely new step in the HIV viral life cycle, which makes it valuable for resistant strains of HIV. Lenacapavir is a long-acting formulation administered subcutaneously every 6 months, which can vastly improve patient adherence in comparison to once-daily oral regimens. In the Capella clinical trial, when studied in patients with HIV, lenacapavir showed strong results in heavily treatment-experienced patients with multi-drug-resistant HIV-1. It led to significant reductions in viral load and improved CD4 counts when used in combination with optimal background therapy. In Purpose 1 and 2 clinical trials, when studied for use in pre-exposure prophylaxis, 100% and 99.9% of patients taking lenacapavir remained HIV negative, respectively. This was statistically significantly lower than with emtricitabine tenofovir. Overall, lenacapavir's effectiveness, coupled with its dosing schedule, gives patients who struggle with adherence or who have multi-drug-resistant HIV another option, which is so important. Lenacapavir is a CYP3A4 substrate, therefore strong CYP3A4 inhibitors can increase lenacapavir exposure, and strong inducers can reduce its effectiveness. Lenacapavir is contraindicated with strong CYP3A4 inducers such as phenytoin, rifampin, and carbamazepine, and others due to the risk of therapeutic failure.
Awesome, thanks, Caitlin. With adherence being a major barrier in prep care, I see this agent taking off potentially. Now let's talk about safety, clinical pearls, and counseling points. What is the most important for pharmacists to know about lenacapavir?
Great question. When it comes to safety, clinical pearls, and counseling points, here are a few things that pharmacists should consider. First, lenacapavir is available under 2 brand names. Sunlenca is used for treatment in patients with HIV viral infection, and Yeztugo is used for pre-exposure prophylaxis. Both Sunlenca and Yeztugo come in oral, tablet, and injectable form. The oral tablets are used in initiation and if the patient takes a break from the injections, and the injections are primarily used for maintenance. Lenacapavir is generally well tolerated as an injectable medication. Its most common side effect is injection site reactions, with other common reactions including nausea and headache. One big advantage of lenacapavir is that it is given subcutaneously every 6 months. A few things to remember when initiating lenacapavir include that oral tablets are used during the initial lead-in period before switching to injections with 2 different dosing regimens. The first dosing regimen includes an initiation period of using lenacapavir injection and lenacapavir oral tablets together on day 1, followed by the oral tablets only on day 2, then only the injection every 6 months from there for maintenance therapy. The second dosing regimen includes an initiation period with oral tablets on days 1, 2, and 8, and the injections on day 15, and then every 6 months thereafter for maintenance therapy. Lenacapavir for treatment should not be used alone. It must be used with optimized background therapy. During the maintenance period, if a patient misses a scheduled 6-month injection by less than 2 weeks and/or knows that they will miss an injection by more than 2 weeks, lenacapavir oral tablets may be taken for up to 6 months until injections can be resumed. At 26 to 28 weeks since the last injection, patients should be taking the maintenance oral dosage of 300 milligrams once every 7 days for 6 months, and injections can resume at any point within 7 days of the last oral dose. If more than 28 weeks have passed since the last injection and lenacapavir tablets were not started, the initiation dosage regimen should be restarted from day 1. Counseling points for your patients should include the possibility of injection site reactions and what they may look like for the patient, such as swelling, pain, redness, and injection site nodule, an emphasis on the importance of maintenance and not missing doses. As with any medication used to treat HIV, patients should be made aware that this is a tool to ensure viral load suppression and not a cure. Ensure to discuss the patient's drug regimen and look out for any strong CYP3A4 inducers like rifampin or anticonvulsants, which can reduce the effectiveness of lenacapavir. To sum it up, lenacapavir is a first-in-class antiretroviral therapy used to treat people with HIV infection and as pre-exposure prophylaxis. It is a long-acting injectable administered twice a year and generally well tolerated, with the most common side effect being injection site reactions.
All right. Thank you, Io and Caitlin, for such an insightful review of these 2 new important therapeutic agents. I hope that our listeners are taking away the most important information related so that they can better be prepared as the medications start to hit their shelves. So to wrap up today's episode, gepotidacin is a first-in-class antibiotic treatment for uncomplicated urinary tract infections with a safety and tolerability profile similar to other agents. It's taken twice daily for 5 days, with mild to moderate diarrhea being the most common side effect. It's effective against common uropathogens, including common drug-resistant strains, offering the medication as a new valuable option when standard treatments such as nitrofurantoin may fail. Lenacapavir is a first-in-class antiretroviral therapy used to treat people with HIV infection and as pre-exposure prophylaxis. It is a long-acting injectable administered twice a year and generally well tolerated, with the most common side effects being injection site reactions. With the twice annual administration schedule, lenacapavir makes the barrier of adherence less of a barrier in HIV treatment and prevention. All right, folks, that's all the time we have for today. Look out for part 2 of this month's First Fill podcast that will be released next Thursday. In that episode, we'll chat with a subject matter expert about her take on lenacapavir and how she sees approval of the agent impacting her practice. If you're interested in more content on new drugs, our August Pharmacy Today continuing education article covered several others. Additionally, earlier this year, we launched a full certificate program on implementing HIV PEP and PrEP in pharmacy practice. Be sure to check out both of these programs in our learning library. And last but not least, don't forget to collect CE credits through the learning library at pharmacist.com. We'd love your feedback on this episode, and we'll see you next time on The First Fill. Take care.